Evening, everybody, and yes, good evening, everybody. Thank you very much for joining me this evening. My name's Dr. Joe McGirr, and I'm doing a presentation this evening on my Rural Health Advocacy Plan. And with me assisting is Rochelle Kell, who handles community engagement. Rochelle's just waving there. Rochelle will assist by looking at comments in the chat and helping me with the slide presentation. As we go through, can I begin by acknowledging the traditional custodians of the lands where we are all meeting? For me, that is the Wiradjuri people here in Wagga Wagga on the banks of the mighty Murrumbidgee River. But of course, that will be different for each of you. And I just acknowledge elders past and present and any who are joining us today. Okay, so the format for today is that I will outline briefly, probably over about 10 or 15 minutes, my Rural Health Action Plan, how it came about, what it consists of, what actions we've taken as an update. And at the end of that time, there'll be an opportunity for you to either make comments or in this chat, or alternatively, put your hand up and we will flip, we'll hear your questions and we'll begin a dialogue. So hopefully it'll be a relaxed atmosphere, and I'm very keen to get as much feedback as I can from you all. We've had a number of forums throughout this year which have been great. This forum is focused on some of our consumer organisations, and we've invited members of Can Assist, New South Wales Council of Social Services, One New Eurobadalla, I think that is, and Fitzroy and Melina there. Also Parkinson's New South Wales, Health Consumers New South Wales, the National Rural Health Alliance, consumer representatives of that organisation, and Remote Australians Matter. So they're some of the organisations that have joined our Rural Health Action Plan. And so I welcome everybody here. And Tara, thank you for your comment there about where you're from. Thank you. That's great. All right. So the 6-point health action plan, Rural Health Action Plan. The background to the plan is that as a member of the Legislative Assembly, member for Wagga Wagga, I chaired a Legislative Assembly Select Committee on remote, rural and regional health, the purpose of which was to look into the implementation of the recommendations from the Upper House Inquiry of 2022. My committee produced 3 reports over 2 years. The last one was in May 2025. And the government has responded to those reports, has accepted a number of our recommendations, noted others. But at the end of that 2-year period, having done quite a lot of work with the members of the committee, it became apparent to me that we weren't getting the response from the government or New South Wales Health that we wanted, that we weren't seeing the focus on rural health services. And in fact, in some instances, rural health services were at risk of going backwards. There were some areas of real crisis. And actually, there was also an issue around accountability for New South Wales Health. We saw some local services closing. We saw maternity services at further risk. We'd already seen a reduction in maternity services. We had people facing long drives and distances to access services. And we found communities left out of decision-making. And a lot of the rural health workforce actually provided by fly-in, fly-out services at great cost. And I really felt that having done the work in the committee, we needed to do something to raise this issue and try and unite rural voices. And this was the birth of the Rural Health Action Plan, which I developed last year. It has 6 points to it, and I'm going to go through each of the 6 points in detail, in a bit more detail. But right at the outset, I want to make the point that this is an advocacy plan. It is not a detailed plan. I'm not a health bureaucrat. I was in a past life, I guess you could say, a health bureaucrat, but I'm not now. This is an advocacy plan. This is to say, look, these are 6 elements that we would like New South Wales Health to focus on, that we think would make a big difference to rural health. So I'll go through each of these. I'll just go through them quickly. There's the GP guarantee, which is about primary health. There's birth closer to home, which is around maternity services. There's local voices, real power, which is around community input. Local staff, not fly-ins, which is about making sure we recruit more health workforce. There's a watchdog for rural health, which is, in my view, a rural health commissioner. And then one system working together, and that's about creating health precincts. And I'm going to explain each of these in detail, in a bit more detail, but just want to highlight there's been some commentary that this isn't a very detailed plan. It's not a detailed plan in the sense of a detailed strategic plan. This is an advocacy plan. I am trying to unite different voices in our rural community, consumers, health professionals, local government organisations together, so that instead of being split, we are united and we get the government to focus on rural health. Not just the government, but the opposition and the health system itself. So let me go through each of these in turn. The first one is a GP guarantee, and this is really around comprehensive primary health care in rural communities. The GP guarantee is the phrasing we've used because that resonates with communities. But I'm not talking about a model in which a GP works on their own 24 hours a day in every rural community. I am talking about a system in which rural healthcare is, I am talking about a system in which primary healthcare is provided by a multidisciplinary team of healthcare professionals working at the top of their scope of practice. And they will be supported, after our services will be supported by virtual services in many instances. So I'm open to that. But what communities have told me is they understand the importance of virtual healthcare. They understand the importance of that supporting professionals, but they don't want it as a substitute for face-to-face care and in-person care. And primary health care is really, really important on a range of fronts. But it's important in terms of prevention, it's important in terms of early intervention, and it's important in terms of community awareness and build up in the management of chronic and complex care disease. It's one of the key gaps in our health system. Now, I'm just going to, people just have to excuse me for just a moment. I'm sorry, I've just got to attend to something in my office here. I'm on my own. I won't be a moment, Rochelle, if you just excuse me. I will just...
After Dr. Joe's presentation, there will be the opportunity to provide comments and questions, which you can do in the chat function. But if you want to raise your hand to speak, you just need to click the react button once we stop sharing the slideshow. But Joe will finish the presentation in the next 5 minutes or so. And once he's done, there'll be plenty of time for questions and comments. So hold tight and thank you for your patience.
Okay, thank you. Sorry about that. Thanks for being so patient. Right, so that's the GP guarantee, and I've recently completed a tour of Barwon with Roy Butler, parts of it, and it's clearly a really important issue throughout the state. I'll go into the next point now, and that is the maternity services. This is birth closer to home. And in the last 15 years, we've seen maternity services gradually decline in rural and regional areas. The government will say not so much during their term. That's because I think they've kept them open in name. When you actually talk to health professionals, it's pretty clear that a lot of our level 3 district hospitals are struggling to maintain maternity services. Look, this is a sentinel issue. It matters to rural communities. It matters to women and their families in rural communities. If we do nothing, the default position will be that people will end up only being able to give birth large regional centres. And as we've seen, they may even not be able to do that. For example, the instances where people have had to go past Tamworth Hospital to give birth. It clearly is an issue of workforce. It's not an issue of safety. There's sort of an argument in the health system that, you know, women need to give birth in sophisticated facilities. That's actually not, there's no evidence that that is safer. In fact, with the birth trauma inquiry, there is actually evidence, in my view, that breaks down continuity of care. GPs, obstetricians with midwives, midwifery group practice, there are a variety of models, are very viable, very safe options for women in communities. But it does need a focus. It does need, you've got to commit to sustaining those services and making sure you develop the workforce and then make sure they've got options to be employed. And unless you work at it, the system seems to default to those services disappearing. We've got a pipeline of rural generalists who could provide those services, but the government should commit to reopening a couple of maternity services. If they do that, what will go with that will be surgical and anaesthetic services. It will be a build-up of that hospital. You get better antenatal and postnatal care. I think you get a better system overall. So it's a sentinel event, but it's important in its own right. So that's birth closer to home. The third point, thank you, Rochelle, is local staff, not fly-ins. And $270 million a year is spent on locums. Locums are important for leave relief. They are important to supplement rosters. I understand that. But when you have entire services relying on people flying in and flying out, you do not get the social capital in your local community. You do not get continuity of care. And anyone who's working in that community, they are getting undermined in terms of what they do. They get undermined in terms of what they do because they've got someone who comes into their community, gets paid more money than they're getting paid, and basically and leave without providing the follow-up care. So that is an issue and a problem. So the fourth item, thanks, Rochelle, local voices, real power. We found as we went through, the committee found as it went through, and I've subsequently found in my talking to communities, visiting communities, that communities feel disenfranchised. They don't feel like that the comments that they make have an influence on the health districts. They feel like the system has a very strong metropolitan basis, and they don't feel like their voice is being heard. This was reflected in the Special Commission of Inquiry that talked about the need for proper health service planning. So I feel that we need to be much more transparent in decision making. There should be genuine consultation, and that includes genuine consultation with First Nations communities. The fifth point is a watchdog for rural health, and this is about creating an independent rural health commissioner. The committee found that New South Wales Health had its own report on the implementation of its recommendations. When the committee checked that, we felt that half of the recommendations that had been reported completed, only half were in fact completed. We just think that it's inevitable that if you're an organisation paying a consultant to do a report on your work, that they're going to give you the report they think you want. I mean, it's just part of life. If you want real accountability, you've got to have an independent process. And we think the only way to get that is a rural health commissioner. The health bureaucracy is large. I think 180,000 people. It's the largest in the New South Wales government. New South Wales government's the largest employer in the Southern Hemisphere. It's a massive bureaucracy. It's a strong bureaucracy. It's a bureaucracy that delivers good outcomes for people. Don't get me wrong. But how do we as consumers hold the bureaucracy accountable? It's very difficult. It's even difficult for parliamentarians of the parliamentary committee. So I think an office established with powers to investigate, monitor and report to the parliament is a key element in keeping focus on delivery of those outcomes. And the last point is one system working together. And it was quite extraordinary as we went around and looked at different parts of the state. It was quite extraordinary to find PHNs and LHDs. Look, they knew of each other's existence. There was often high-level meetings between the chief executives of some PHNs and LHDs. But by and large, on the ground, they weren't working together. There's no requirement to work together. One's federal, one's state. And yet, if they could work together, they could produce really good outcomes, particularly in the area of primary care. And there are examples of this, particularly in my region. In addition to that, we've got universities training a lot of health professionals in rural areas. And they bring the resources of universities in terms of research and expertise. And finally, we've got local government. Our committee made a number of recommendations about local government. First time anyone's recognised that local government has a significant role. Now, local government, I don't want local government to take on health, but the fact of the matter is local government often does provide health services. And when I've met with local government, they regard this as their major concern. And in fact, can I add, local government New South Wales 2 weeks ago launched its own 6-point rural health action plan, which is great. Pretty much copies mine, except it adds in aged care, which of course is a federal responsibility. And I think we've got a lot of local governments come on board to support this. It's a big issue. And I think they need to be at the table. And the model I'd like to think is that we established a range of precincts where we bring the PHN, the LHD, local government, universities and private providers together with a small amount of quarantine funding to do their own workforce service model and research. And that way we bring those voices to the table. I don't think this would require a lot of money, but it would need to be funding separate to the LHD funding. And it needs to give, let's face it, our communities, our LHDs, our health services, the strategic bandwidth to do their own place-based recruitment and retention, research and one service facilities. So that's 6 points, and I'm happy to elaborate on them. I hope what I've said is clear enough. Rochelle, the good news is we've had 50 organisations come on board since we started this last year, and that's fantastic. And that doesn't include, I have to say, the AMA, who just as a principle wouldn't do it. And I've had very positive support from New South Wales nurses and the Health Services Union as well. 50 organisations, great outcome. And now with local government New South Wales pushing its own plan, there'll be even more pressure on the government. And thank you to all of you and your organisations for coming on board. Last year we launched this in August, September, and then built that up to November, which is Rural Health Month, and presented the open letter to the Minister then. We had a bit of a break in December and January, and this year we have launched again with a town hall meeting with our supporters, a series of town hall meetings, and this is one of them. We've had one with the CWA, we've had one with maternity groups, we've had one with local government, New South Wales, and we're having one with consumers now, just to continue to socialise this. I've done a number of tours. I've been up to Queensland. I've been, as I mentioned earlier, into Barwon with Roy Butler. I've been to Taree with the Manning Great Lakes Hospital Action Group, great group up there. And I've had a number of meetings with MPs, including the Health Minister, briefed MPs, and I've got a big briefing in Parliament on the 2nd of June coming up, where I think we've got over 60 people, Rochelle, attending that. And a lot of our supporters are coming to Parliament to make sure the government hears the message. We're being respectful. We're trying to be positive, but we're trying to put pressure on. We don't want rural health ignored. I've met with Kelly Sloan and Gurmesh Singh when they were their opposition spokespeople on health at the end of last year. And can I just say, within weeks of meeting with them, they'd both been elected heads of their parties. So there you go. That's the influence of the Rural Health Action Plan. I'm only joking. Anyway, I've had a very supportive crossbench, and the new Shadow Minister, Sarah Mitchell for the opposition, has been very supportive, and I've had some interaction at federal level as well. So this is all part of building up the campaign. We've had very good media coverage. It is difficult to sustain media coverage over a long period of time, but the point is this is a long game, and we're now well and truly into pre-election phase in the New South Wales Parliament. We've got the election in March this year. And my goal, the government's not going to make major policy commitments now, this close to an election, but I want this to be an important issue in the campaign, important issue in rural communities for all parties. So when the government, whichever persuasion the government is, when it's returned, it realises that it has to do more in rural health. It has to take on more action than what is currently happening. And so that is about keeping the pressure up. Okay, so what next? As I said, we've been holding our online town hall forums, and one is tonight. So thank you very much for joining it. We're continuing our media campaign. I've introduced a bill to the Parliament, the Right to Primary Healthcare Bill, in which I'm trying to create an obligation on local health districts to tackle primary healthcare in rural and remote areas. That is a way of highlighting that issue. I suspect the government won't support the bill. I think their view is that it's a federal government responsibility. I guess my view is I'm sick of the state and the federal governments tossing this around in rural and regional areas. We need to get a commitment from one level of government that it will tackle it. I will be introducing a Rural Health Commissioner bill later in the year, and we're capping off our 6-month campaign with an event in Parliament on June the 2nd. Thanks, Rochelle. Well, just before we go to questions, how can you show your support? It's obviously sharing stories is important, and any stories that you got is really important. And a number of you have reached out and spoken to me, so thank you very much. Also, contacting members of Parliament is important, and your local MP is really important. And I never knew the importance of visiting your local MP, but actually a personal visit from someone who's articulate and understands the issues and speaks from personal experience and background is a very powerful thing for an MP to hear. So if any of you know your MPs locally and you can mention this, it's a really important strategy. So thank you very much. We've got material that I'm very happy for you to share with your community. I know a lot of members of different organisations have been bombarding members of Parliament and pushing through their organisations, which is great. And that's the sort of ground roots pressure that we need. I'm trying to keep this as a community campaign. I'm trying not to have it too linked to me. I don't see it as a personal Joe McGirr thing. I see it as trying to build a genuine consensus that has bipartisan support across the state, because I'm very passionate about it. There's more information available on my website, and also feel free to contact my office and get updates to the campaign. So thank you, everybody, on that. I've spoken far too long. I'm going to stop right now, Rochelle, and ask if there are any questions, and Rochelle's going to keep an eye out for them. But we actually have got some comments and questions in the chat.
And if people, when they're putting their questions in or raising their hand, if you just want to say what town you're from, if you're associated with an organisation, that would be great. But yes, Joe, Tara's popped in a couple of questions from Health Consumers, Tara, New South Wales. Yep. First of all, what response have you had from Ryan Park, and also asking if there's a link to the two bills?
We'll make sure that all the participants tonight get a link to the two bills and that they're on our website. We're still just consulting on the Rural Health Commissioner bill, but the Primary Healthcare Bill is up and running. So we'll make sure people have that. And thank you, Tara, for your comment about local government and its important role in rural and regional areas. And really, local government is distressed, partly because it often picks up responsibility, which is unrecognised, but it also is aware that health services are an important attractor for business and investment in their community. And they really value them, and they hate to see them downgraded, and they hate to see the virtual care being the replacement for services. I mean, we get that virtual care and accessing specialists is great. Everyone understands that, but people want services on the ground in their communities. And look, I was at a forum yesterday, an agricultural roundtable on safe work health and safety, believe it or not. And this had people from across the state. And it was amazing that health services came up there. And people are talking about they want services on the ground. Of course, they don't want neurosurgery and Moree, but people do want comprehensive primary health care, and particularly primary health care and its role in providing a gateway for mental health services. So thank you for that. And Melina and Fitzroy there, thank you very much for your support. Look, the response I've had the minister has positively acknowledged the plan in Parliament, and I've raised it with him and the Premier. The response, look, I think I have annoyed the bureaucracy a lot. I try and keep my relationship very professional. Their response is, we're already tackling these issues. That's their response. We already have a plan. We're already tackling these issues. And I beg to differ. I beg to differ. I think that the plan is better than the previous plan, but I don't think they're really tackling these issues. I would just like to see a couple of maternity units reopened. That would just be an absolute winner. And I reckon that's going to stretch the system. So I think it'd be fair to say, I think the rural health sector does a great job. I think it gets around. I think don't get me wrong, people are trying, but can I also say I don't think they're trying enough in rural areas. I just worry that we're managing a decline, that we're shifting stuff to virtual services. So I just think we need to keep pushing on that. So we'll put a link to the bills. On behalf of our colleague, Dr. Arne Sprogus, what role does the Federal Health Department have to play in addressing these issues? Very good question. And so I don't want to go swim outside my lane, because obviously I'm a state member. But I did take the opportunity to meet with the Assistant Minister for Health, Emma McBride, as well as the Federal Rural Health Commissioner. There's a couple of issues, I think, at federal level, and the National Rural Health Alliance has been a very strong advocate. I think Australia needs a rural health plan, rural health strategy. For some reason, the federal government just resists that. I don't understand why, but they just keep resisting it. So I think that's something they can do. And I would like to see the federal government come together with the state government for remote and rural communities and develop an alternative way of funding primary care that enabled pooled funding to be provided to communities to establish primary healthcare services. So that's a couple of things I think they could do.
Joe, can you see Emma's question there? It's a bit of a longer one, but late last year, Ryan Park announced his commitment to a rare disease strategy for over 700,000 people living with rare complex conditions. Many of these people are in remote regional areas facing vast inequity, and Emma would love to ensure that these rural families are centred in the work, and would love to see the findings of the New South Wales Senate Committee on access to fertility services. Again, vast inequity for rural people. So I think there's some niche issues there. How do we get rural people involved and in those, Joe?
Yeah, look, thank you. Thank you for that, and thank you for your advocacy in that area. Really important issues. And look, when it comes to rare conditions and specialty areas, I think we all accept that in rural and remote areas, people are not going to have access to services on the ground. You know, there is a need for a concentration of specialty services in metropolitan areas. I think we all get that. I think what people miss is when they've got to navigate that system, which is in Sydney, themselves from a remote location, that they've got to go online and negotiate the system through online links and telehealth links without the personal interaction. And I think that there's a couple of ways we can help with that. I think having properly equipped primary healthcare, healthcare professionals that are at the top of their game, general practitioners that develop specialty skills that can, along with nurse practitioners, paramedic professionals who can provide that face-to-face, can provide the liaison between individuals and the system, can advocate for individuals with the system. I think that's an important part of it. And I also think an important part of it is actually have outreach services so that people don't always travel. There's a great reluctance to provide those. People talk about the cost of it, but I have to say, in instances where you can have specialty services come out, particularly for children, can I say, into regional areas, it takes even a couple of visits. if you can avoid families travelling to Sydney for just a couple of times by having an outreach service, a couple of things happen. First of all, it's great disruption to families when they've got to travel to Sydney, particularly for children, tremendous disruption. But secondly, you also skill up the local professionals. You actually bring care out, and that helps in the interim. So I think there's a couple of things that we can do there.
Danny's mentioned, oh, sorry, go.
Yeah, go on, Rochelle. Yep.
Danny Gordon's mentioned, great to see the CWA involved, one of the first partners to come on board, I'll note. Can you campaign to Rotary and Lions clubs and parents through school newsletters?
Great idea, Jenny. And hi, Jenny. How are you? Great idea. The CWA have been really strong on this, I've got to say. And at the Agriculture Roundtable yesterday, the President, Tanya Jolly, was there and spoke very powerfully of the importance of health services. So they are right on board. And of course, the CWA was founded back in the early 1920s on the issue of maternity care. The issue of maternity care was a huge issue for them. And the irony is that 100 years later, having fought, that they're actually looking at, declining maternity services in particular, but more broadly health services and mental health services for their members. A great idea about Rotary and Lions. I'm always nervous. Rotary and Lions try and remain apolitical, and I'm just always a little bit careful about crossing that line. But let me have a think about that. As it happens, I'm president of the New South Wales Parliamentary Lions Club, and I feel it might be a bit awkward using that. So I just want to be careful about that. And I do speak to Rotary clubs, but look, and parents through school newsletters. Well, of course, I'd have to get out through the New South Wales education system, and I just suspect the government might not let me do that. So anyway, but I appreciate your advice. Look, Tara, you've asked about how the plan can work with the Regional Health Strategic Plan. Look, I acknowledge there is a Regional Health Strategic Plan. I get that. And I think there's a lot of it that, look, it's better than the plan that existed before, and that was an outcome from the Upper House inquiry. But a lot of it is still tailored. To me, it's a rural version of the Metro Plan. Like it takes the Metro Plan priorities and ruralises them a bit. And to be fair to New South Wales Health, they have stabilised the rural health workforce. They have lifted the wages cap. They've doubled the incentives to the rural health workforce. So they have done quite a lot of work in that area. But primary care is under threat. Maternity services, I don't see action on that. I don't see empowered consumers. The issue of locums, we're still using locum services to sustain rural health services. It's costing a fortune. You'd think they could at least establish a locum agency. They promised to do that. It still hasn't happened. Of course, they won't like a rural health commissioner, and that's being resisted, and that's not in the plan. But look, so what I'm trying to say is, look, we don't want a ruralised metro plan. We actually want place-based solutions driven from rural communities, empowered rural communities, and let's try and make that work. Let's try and have a unique way of putting that forward. And I'd like to see primary care supported, and I'd love to see rebuilt maternity services in communities. So a great question. Thank you, Tara. But that's how I see it working. And as you can see, I am trying to be positive about this. I'm trying to engage in a sensible way, but I can't, obviously, I don't have the resources to detail in a detailed plan. What I am trying to do is create an awareness that this is an issue. We've got an election in March. We need the government to come on board with it. So I hope that's answered those questions. Don't know if there's any others or anyone wants their hand up.
Oh, we have a hand raised by Emma. Off you go, Emma. Can you wait?
Oh, thank you. I was going to put this in the chat, but I thought in the silence I would ask it. So
Thanks, Emma.
I work at Genetic Alliance Australia, and we are national but New South Wales focused, and we have a significant focus on our families that are in rural and remote areas. But what I so appreciate about the focus of this discussion is that often sort of rare disease issues are seen as kind of tangential or specialized, but actually what we are focused on is strengthening primary care's response to rare conditions, because genetic healthcare is expanding. It's expanding within primary healthcare settings. We're seeing more and more genetic testing, for example, reproductive carrier screening, people making really significant decisions about the health of themselves and their families as a result of that. And there is a real workforce gap, an issue within primary care settings around being able to deliver this care to families. And a significant kind of barrier is also being able to access genetic counsellors. And that is a national issue, but it's very much an issue that is exemplified in remote and rural settings, because a lot of that contact is either through long wait lists or outreach programs, as you rightly said. So I would love to know how we can support these more, I guess, kind of primary care centric aspects of care. And one of the things that really surfaced in the evidence hearing last week that we attended for the New South Wales Senate inquiry on fertility services was the fact that for women who either had a at-risk finding through carrier screening, which is now open to population. It's something that's going to increase in terms of the number of people going through screening. Their opportunity to access lower cost or accessible IVF, and in particular IVF with pre-implantation genetic testing to avoid passing on these really debilitating, genetic conditions, is next to unavailable in rural settings. And was fascinating listening to some of the, like, for example, the Westmead Fertility Centre, which is the only, to the best of our knowledge, the only public fertility centre that's offering a specific remote program, talk about the feasibility of that with more funding, how that can actually remarkably increase rural, prospective parents' access to reproductive care that actually prevents severe lifelong conditions. So this is more, I guess, of a reflection just to say thank you so much, and that we actually do see that there's a real need for primary health care in rural settings to be able to respond to these elements of care, even more so in rural settings in the absence of some of the infrastructure that people in urban settings can access.
Yeah, thanks, Emma. And that's an absolutely classic situation. And I think, Emma, you'd agree that the specialty techniques need to be in centres with a metropolitan base. But the problem is that we just don't want people simply accessing that online or travelling, because it's such a sensitive area. It's such a personal area. And so you need the bridge, and the bridge is primary care, but primary care, not 10-minute medicine. Like in the city. I mean, in the city, you can have 10-minute medicine because you're closer to specialty services. No, we need comprehensive primary health care where you've got professionals who can be with women and their families when they're getting that advice, who are involved in the care, who can help people make those decisions and make sense of the information. I just think it's the gap. And unfortunately, I think that's the role of primary healthcare. That's why we've got to continue to fight for it in person, not just online. Yeah, so thanks, Emma. That's great. Absolutely right. And I just noticed, Melina, I hope you've talked about the funding there around the gap, $5,000 ahead. But yeah, I think National Rural Health Alliance has estimated that the gap the unspent funds in rural and remote across Australia is like 8.4 billion a year. And that comes about because there aren't services, people don't charge fee for service, the government doesn't pay. And that gap is well documented by the National Rural Health Alliance. So that doesn't surprise me. I think, of course, no one has any money at the moment. And after the last budget, everyone has less money. And the cost of living pressures are intense. But there's no doubt that there is an underspend in rural health, and it's not right. No, it's not right. And if the federal and state governments could come together, pool the funding, find the funding they're not spending, pool it, and provide communities with some options around building primary healthcare services and give community the ability to get involved, then I think that would be a way of overcoming that health gap in any case. And thank you. There's a comment there about the plans lacking a patient-centric focus. And of course, everyone says in the health, and look, I worked in the health system and a long time both as a clinician and as a health bureaucrat. And we do talk all the time about a patient-centred focus. But the system is the system, and systems look after themselves. And I think getting a real patient-centred focus is hard, actually, in the system. And part of what we're talking about here is getting that back for rural communities. So thank you for that. All right. Well, look, thank you very much, everybody. I'm just flicking through. It's been great to have you on board. I appreciate everyone's input. Has anyone got any last comments or final comments to make? Jenny.
Joe, I'm going to say I'm still in the system, in the university sector and in the bureaucracy of the whole system. And it's actually really good to see an advocacy plan for the people of the state to actually have a voice above and beyond what is currently available. And in our rural sector and in our First Nations communities, it's a really lacking space for people to actually have that voice to say, this is what we want, this is what we need. And thank you for the work that you're doing in that space.
Oh, Jenny, that's fantastic. So nice to see you. Thank you for keeping up the fight and your work. But yeah, well done. Thank you. Yeah, I think, this is an important issue. And look, I started this thinking it was an important issue. I have to say the interactions I've had with people as the plan's been running forward has just reinforced that, because every so often you go to the government and they'll pat you on the head and tell you everything's okay and that there's nothing to worry about. And you sort of wonder to yourself, maybe I've got this wrong. But when I actually engage with people in communities, it's pretty clear I haven't got it wrong, that there is a gap here and we're just not doing quite enough and we need to keep the fight up. So thank you, Jenny. And once again, can I say thank you to everybody who's come on board tonight. We've recorded this and hopefully we've got your details. We'll send out information about staying in touch with the campaign. I just appreciate the support that people who've contacted me have provided me. It just helps us. It helps us keep going. So thanks everybody for joining tonight. I'm going to wind it up there. I think you've heard me talk a little bit. I could probably talk for a couple of days on this, but I won't do that. But thank you once again, everybody, and all the very best. We might call it. We might finish it there. Thank you.